I love this question. Are NAD plus and NADH interchangeable? So I know you described the difference. One is the oxidized form and one is the reduced form. But
Mhm.
there's people out there saying you should take NAD plus, which has always confused me because that's the oxidized form. But people like Dr. David Sinclair are talking about NAD plus and the precursors, like someone else is asking about NMN, which is a precursor of NAD plus. And then there's the research in ME in particular is always using NADH, which makes more sense to me because in general, we want more reducing agents in our body. But I'm just curious what your take is on that.
You know, that's why I really picked this supplement, so I
Yeah.
could maybe do a deeper dive. And I agree with you. What seems to be readily available is NAD plus.
Mm,
So, but it does make more sense, NADH. So that's what I can tell you, that I'm still trying to figure that one out.
okay.
And yeah, and let me go back to NAC and glutathione.
Yeah, yeah.
So there was a study, it's been about 2014, at an ME conference. And one presenter talked about glutathione and what it does for patients with ME. And then another one, it was a very interesting presentation, said, nope, you have to go with NAC, because the problem with patients with ME is that we have difficulty converting NAC to glutathione. So they actually had a discussion. I don't know if you were there.
I don't
Um,
think so. I don't
they had
remember
a
it.
discussion going back and forth. And so I left there thinking it may be that we are unable to convert it, right?
Mhm,
So, so I just keep that in mind. For the healthy population, NAC would be fine, right? Because it should
mhm,
bring up glutathione levels. But one of the reasons I sort of promote glutathione is because of that study that said, nope, that's where the problem
mhm.
is. So,
Okay, that makes sense.